Hi everyone, my name is Farida Sewa Bube, founder of Endometriosis Foundation Ghana. Today I bring you news about endometriosis as much as Endometriosis Awareness Month. I would like to educate our husbands, our boyfriends, our girlfriends, our aunties, our family, everyone, our grandpas and grandmas, mothers, sisters, wives about endometriosis. Why am I passionate about endometriosis? Because it seems to be a silent condition that affects 1 in 10 women. It's a condition that a lot of people don't know about. It usually affects women in their reproductive age. So between menstruation, as in before menarche, before you start your menstruation, and before menopause, those are the age groups that it affects. Endometriosis does not really matter. It doesn't really consider your socioeconomic status. It doesn't really matter whether you're rich or you're poor. So long as 1, you're a woman, and then 2, you are in your reproductive age, you're menstruating, you are likely to have children. That is when it happens. So let me tell you more about endometriosis. So it's a condition where tissue that is similar to the inner lining of the womb is found outside of the womb or the uterus. So it can be found in the abdominal cavity. Some people have reported with it in the bladder, even in the kidneys, in the liver, even in the lung. There's been a case of one having it in the eyes or the tear that such that during the time of the month she starts shedding tears of blood, and it's a real thing that is happening. So once the tissue is found in those areas, it behaves like the one in the womb. So during the time of the month, when it is shedding blood, when it's creating cramps and all, you feel that kind of pain in your system. I'm passionate about endometriosis because I have known people who have had it, and I've known how debilitating the condition can be. It reduces your quality of life, and it makes it difficult to, be yourself, be a woman. And it actually happens during the fun times of your life. So the pain it brings makes it really hard for you to live with it. Now, how do we determine who has endometriosis? Unfortunately, the way it's diagnosed, it can take a long time. Elsewhere it can take 7 to 10 years. And in Ghana, it can be longer because it is similar to your menstrual cycle, and then your menstrual cramps, the symptoms for this mistaken for fibroids. It can be mistaken for any other thing. So unless maybe you go to the same doctor all the time, but when you go to a hospital and then you tell them that, oh, you are in pain, they will just prescribe painkillers. Unfortunately, with endometriosis, it's not all the time that the painkillers work. You may need more. You may even need rest. You have to miss out school and work in order to feel okay. But a lot of the time, some people do not understand. So you are left with wandering from one hospital to the other. So it just takes maybe one prescriber, one clinician, one pharmacist, one nurse who would say, oh no, this one is the condition I've read about in the book. And that is when they will draw attention to endometriosis as a condition for you. Now, how do we investigate it, or how do we finally diagnose it? One sure way of finding out about endometriosis is through laparoscopy. So that one is using a probe that has a camera attached to it to look inside your pelvic area to find out for sure whether there are the endometrial implants there. However, you need a specialist. You have a gynecologist. Yes, he can help you with that, but you need someone who also has the skill to use that technique to diagnose it. In Ghana, where this service is limited, they can use your history, to find out if you have the condition. And once it's found, they can intervene with, treatments and all. Because I just want to talk about the condition, I may not be able to talk about specific medications that can be used, but it can be treated medically with painkillers. We have painkillers called NSAIDs, or non-steroidal anti-inflammatory drugs. There are some contraindications to it, so you have to speak with your pharmacist before you take those medicines. certain contraceptives and all can be used, but you always have to seek help from the specialist. You can also go through the surgical technique. The same laparoscopy can be used to surgically remove the implants in your abdomen and in the areas that are not supposed to be. And then you can also go through physio if it limits your mobility. And people also go to, herbalists, but because we are not too sure of herbal medication, you always have to talk to your doctor and pharmacist before you proceed with that. When somebody has endometriosis, what does that mean for the people around them? If you have a sister with endometriosis, you just have to support her. It's a very painful condition. In the UK Endometriosis Society, they've done a research and classified it as one of the top 10 painful conditions. It's just a whole body disease that comes with a lot of pain. So you have to be supportive. Don't say, Amma, you are so lazy, because you realize you have to do your chores. You say your stomach is paining you. Because they present as that. They will say, one will say, I have cramps, I can't eat, Also, it can also be accompanied by vomiting and diarrhea during your menses. I'm not saying that when it happens like that, it's a sure way of endometriosis. But it's such that sometimes when you urinate, it's painful. When you even move your bowel, when you go to the toilet, it's painful. For certain women, when they have sex, it's painful. Everything is accompanied by pain, and it's not an ideal way to live. So please, let's support our sisters, our mothers, our girlfriends. Let's give them more love during the time of the month when they are actually in excruciating pain. We have period kits. You can just buy them some hot water bottles, some pads, some chocolate if they can take it. Dark chocolate is very healthy for everyone. So you can buy the dark chocolate and you can put some Netflix and let the person chill and allow the person to rest. In concluding, I would like to say that killer cramps are not normal. The pain that is so debilitating, you cannot rest, even if you sleep, you can't have a restful sleep. It's not normal. Always seek advice from a specialist, a gynecologist. When you go to the pharmacy and you always go for painkillers and it doesn't work, you talk to your pharmacist. A pharmacist is also likely to refer you to the right person. Thank you so much, and happy Endo Awareness Month.